My name is Marjorie Campbell. I've been a patient of Dr. Wilson's for 5 years. 5 years ago, I had a stroke, and at the time, I started having migraine headaches. We thought the migraines were due to the stroke, and we did medication for a year. At the time, the medication did not help the strokes, so we started a regime of x-rays and MRIs. On the MRI, we found that I had some deterioration of cartilage in my cervical vertebrae. At the time, there was only deterioration between 2 of the cervical vertebrae. I did not believe in them, but I knew that I had no choice because I have a blocked basilar artery on the left side of my head, and it was recommended that I not have surgery on these cartilages. After I went to Dr. Wilson the first time, we sat and talked. We didn't have an appointment for any kind of treatment or anything like that. We just sat and talked, and then about a week or 2 later, he called me on the telephone at home, and we talked some more. Because Dr. Wilson, I told him I did not believe that you should be just taking or getting pain treatments for the rest of your life. And ultimately, that's what the doctors were telling me that I would probably be doing, because they could not see at that time that I would be able to have any surgery. Mm-hmm. And I was really skeptical. But I liked Dr. Wilson. I liked him because he was so honest with me, and also I'd never had a doctor call me at home at night. And I thought, that's really neat, because he took the time to try to explain it to me again. And I do like Dr. Wilson, so give it a shot. So I called him, and I set up the first appointment. Mm-hmm. Now we've dropped back to a procedure that I do where I don't have to have any kind of anesthesia, and he just goes into the back of my neck and gives me a steroid treatment. There is pain. I don't want to say that there's not any pain. I can't measure pain. They keep asking me to tell them how much pain I've got on a scale of 1 to 10. I don't know what my pain is, because I would think if you cut off an arm, that would be the ultimate pain. To me, my pain is not that bad. But to me, when you can't sleep at night or something like that, it's frustrating. So I have a very frustrating pain, and Dr. Wilson fixes that for me. Before, I was having tremendous, what they say were like migraine headaches. I've never had a migraine headache, but it was putting me in the bed. Of course, at the time, we thought it was the stroke and the after effects of a stroke. I would just have to go to bed. I would be nauseated, and the pain was horrific. At the time, I had no pain pills, and so Tylenol was the only thing I could take. And of course, they were not helping. Now, I do not have those headaches. If I do have them, they go away, and they are not the kind of headaches that put me in bed. I find that, towards the time for the next treatment, the pain is worse, and I know it's time for another treatment, and I'm ready to come. I do not know how I could have lived without having met Dr. Wilson and having these treatments. And I thank my medical doctor for introducing me to Dr. Wilson. He said if I would ever give it a chance, that it would work wonders for me, and it has. It's given me a chance to go back to work and carry on just like I was carrying on. And that year after my stroke, I was doing nothing. I was basically just living day by day, and now I'm carrying on a full life again. So yes, it's made a tremendous difference, and they had to baby me to get me to this point, and I'm ashamed to say that, but I just would recommend it for anybody. I really would.